Hi, I'm Dr. Rajani, and today I'm going to go through several treatments, aesthetic treatments, that I believe you may want to avoid. These are treatments that people DM me about that they're having complications with, that they don't like, or are just found to be low satisfaction treatments. Not only am I going to tell you the things you should avoid, but I will give you alternatives that you might want to research and think about so you get the best results. Below in the more info, there's a link. You can ask me questions. I'll answer them on this channel. Click Ask Dr. Rajani. So, grab your coffee, get your MCT oil. We're diving in. Number one, tear trough fillers. Now, the under eye is one of the first areas to age, so that's why people present with it. Hyaluronic acid cross-link fillers that we typically use, most people know as gel fillers, are not built for the under eye because they do several things. One is they draw water in, and two is they can migrate and move around. I guess a third would be that they can hang around for a very long time in this area. And there's lymphatics that drain, and when they obstruct them, they can make the eye look worse, they can migrate over time, or when they do draw that water in, you can see them, they look irregular and not smooth and confluent. When you look at young skin, and what we're trying to recreate here is a smooth surface in an imperfect area with a lot of muscles, a lot of ligaments, and the technical difficulties with putting that in and the anatomy make it very tricky. So that I would say overall, all comers to most aesthetic practices, the under eye failure rate would be around 20% over a year or two of the patient's journey with this product. Now, yes, you can dissolve the product, but patients don't like dissolving or getting rid of their $1,000 treatment. And the expectations are often too high for what they're going to receive. Now, what are your alternatives here? Well, better choices would be something all natural like platelet-rich fiber, which is your own body's blood draw, or platelet-rich fibrin gel. If you don't want to go that route, another good one would be things like people talk about lasers. I like radio frequency, fractionated RF like Viora's VFR. There's multiple ones on the market. I'm not a big fan of RF microneedling where the needles go in and heat up under the eye. It's technically a little bit difficult. If you're seeing someone that does a lot of these procedures, that's fine. Not a lot of people do enough under eyes with RF microneedling to get great. Think twice about under eye filler for those and many other reasons. Number two is the Plasmapen. Now, so many people were using this, especially a year to 3 years ago. It's a pen they're very inexpensive, and a lot of home gamers actually purchase them, and esthetician clinics. And what they do is they really burn the skin, and they put little micro burns in. Most of them have almost nothing plasma about them. They just literally burn the skin. And people put multiple small dots that go through the epidermis, dermis, sometimes even into the fat layer. So this can be very deep. And the thing is, they're trying to lift the eye or treat the upper eyelid so people don't have to go get a blepharoplasty. They use them on the body, on the face. I often see them on the neck. And it's very, very scary because this is uncontrolled heating. The amount of scarring that I've seen people send me pictures is disheartening. And I'm very fearful of the outcome for these people because that scarring may never go away. So if you're going to get a Plasmapen treatment, a lot of people using these pens, because they're inexpensive, are those that don't want to spend the money on the $100,000 lasers. Now, I believe too, lasers should not need to cost $100,000. But the $100 to $1,000 plasma pens to try and contract the tissue by burning it, I'm not a fan. This is an absolute no for me. Number three would be things like VOLITE. Now, VOLITE is a juvederm type of product. It's hyaluronic acid, it's cross-linked, and it's meant to be injected very superficial as a skin booster or a hydrator of the skin. And the funny part about this is a lot of people who will never get fillers, don't want fillers, will get skin boosting products which are the same thing as fillers, just a lighter consistency, sometimes less cross-linking, and less percentage of hyaluronic acid, but made in the exact same way. They're the exact same product, just a little lighter. And they're put in little injections to hydrate and plump the skin. Now, not bad unto themselves. If you have a lot of money, people can like these procedures. But most people that want to look youthful, that have hollows, that have demarcating fat pads, that have sag, that have jowls, lip lines that are etched in, aren't going to get better with overall boosting the skin. And remember, what you're doing is you're taking filler and you're putting it all over the face. If you don't like it, if it draws too much water in, and these can last 10 years, you have to dissolve the whole face. That's not ideal. While I like Hylenex, I like Dissolver, I use a lot of it, I'd rather not have to dissolve someone's whole face, and that can lead to issues more short term in and of themselves. So skin boosters, and remember, we have many. So there's VOLITE, other skin boosters, which would be Profilo, is a lot in Europe. And if we think in the United States, Restylane Silk is Vital and Vital Light. So that's skin boosters as well. So we have skin boosters in the United States and around the world. I use them for people that really can afford it and that have already taken care of the heavy lifting stuff. Now, what would you use instead of that procedure? Well, go for biostimulators, very easy on that. Sculptra, polyalactic acid, or if you want all natural, go with things like your own blood draw products. Easy Parap, Easy Gel, where we take your own blood, spin it down. You're not having foreign substances to get that glow. Next is the hyapen. And a lot of people don't like to hear me say this, but that's a pen. Again, you can purchase it everywhere for $100 and less. You put hyaluronic acid or whatever you want really as a cartridge in the pen, and it blows the stuff into your face through high pressure air. Now, what are you blowing in there? Well, a lot of people try and do fillers. So they try to do cross-linked hyaluronic acid fillers, which can last a long time, or non-cross-linked hyaluronic acid fillers, which will last a few days to maybe a week. And maybe they have some antioxidant benefits, but they don't last long. Here are the problems. When you try and blow something into your face, it's inexact. If it's not perfectly flat, or the skin, the dermis, and epidermis are different thicknesses in different areas, they're going to go to different depths. So it's uncontrollable. Now the problem becomes if they get superficial, which they will, some will be superficial, some will be deep. It looks irregular. You then have to dissolve it with a dissolver, and a lot of home gamers don't have access to that. It's much easier to inject these products. Another issue is the pens are all different. They have different strengths of air blowing the product in, and of course many people are putting non-sterile products in because where are the pens coming from? Then where are these cartridges coming from? And they're not meant for injections, but where are they going? Into your body. You get one body, you get one bloodstream. What goes into your body is very important. So don't go blowing all this stuff into your body that you don't even know what it is, and a lot of complications from it, and a lot of times people can't then dissolve these. Clinics were using them, they threw them away. They paid $2,000 to $3,000 for these devices and threw them away because people were very unhappy. I advise against that one as well. The next one is surgical. It's a facelift. I don't advise against all facelifts, of course, but here's the two cases where I do. The people who think a facelift is a one and done, meaning you get a facelift and that's the only thing you're going to then need forever. Everyone talks about it being permanent. Facelifts aren't permanent. They typically last 10 years and people go get another one. When people are spending $30,000 to $150,000 now and they think it's permanent, they can be very disappointed. The second reason, or people who I advise against it, are those, there's actually going to be three. The second one are those that aren't prepared for the downtime. It's really 6 weeks where the majority of people don't want to see other people, where they look a little tighter, a little bit pulled, that they just don't feel themselves, and it's a roller coaster ride for these patients. So if you think it's a walk in the park, it's a very invasive procedure. The results can be great, of course, and sometimes a facelift is needed to get that result that people want. But don't get it if you think it's a 7-day or 2-week recovery and you're back to things. And mini facelifts, I don't believe in them. The deep plane smaz facelift is, if you're going to get something done, go for that. The third person that shouldn't get the facelift is going to be that person that is not then willing to take care of their skin. So a classic scenario of a plastic surgical practice would be, I only do facelifts. Facelifts are the only thing that works. After 100, 200 facelifts, people realize they're not happy with the facelift because their skin doesn't look better. The brown spots aren't going. The pores aren't going. There's vertical lip lines, not enough lip volume. There's bone loss. A facelift addresses none of those things. So if you're going to get a facelift, even if you get fat transfer with it, typically people are going to need some biostimulators, some laser resurfacing, great skincare. Lip filler, because as the face and neck does look more youthful, the skin is removed from the facelift. But if the lips and the lip lines are incongruent with that look, it looks bad. People still look, quote unquote, what they say, old. They use the word old. That's because of the bone. So those are 3 cases in which you don't get a facelift, and you'll see full surgical practices, all of a sudden they're renting or doing CO2 lasers. All of a sudden they're doing fractionated radio frequencies. All of a sudden they're doing facials and chemical peels. It's a natural progression, and you see it all the time. So a facelift isn't one and done, and you need ancillary services, and there's a lot of downtime. That being said, the results can be, of course, fantastic and sometimes necessary to get the result you want. The next one is under eye threads. I personally never use smooth threads underneath eyes. I don't put any threads underneath eyes. The eye is very delicate. As we talked about with fillers, there's lymphatics, there's fat pads. The mailer pad that people hate is fibrous tissue. It's not actually a fat pad, it's fibrous tissue. How do you get all that better with a few threads? But the problem isn't just that. The problem is twofold. Number one, oftentimes the threads can be visible because it's superficial under the eye and you're trying to build collagen. Now, if you don't like it, the second part of this, so you can see the thread, maybe you don't like the result. The second part is you can't just get rid of it. The threads go away after 3 months to 2 years, depending on the type of thread. There are permanent ones. Heaven forbid, don't go for a permanent one. But I advise no threads underneath the eyes. That's my policy, of course. There are people who do it and like it, but I would think twice about that procedure. I hope that helps avoid some of the procedures, or at least think twice about them. I put a complete playlist up here on skincare, things you can do at home, keep your skin and body beautiful, healthy, and vibrant.